according to the WHO classification, we have types of FGM. So the very first type, we call it type 1, is the FGM where the clitoris is cut. Of course, we subdivide it such that 1A, the prepuce is just cut. Okay, prepuce is the hood that usually covers the clitoris. I'm sure women, you know what I'm talking about. So type 1.
Okay.
You can either have the prepuce cut or the clitoris cut, or you can have both cut. Then, so that is type 1. Type 2 is when now the labia minora. So if you look at the vulva, the female genitalia, you have your clitoris, you have the inner lips, and we have the much inner lips. And then now you have the introitus. The introitus now is what people usually know. That is actually the vaginal canal. So for the lips, you have the outer lips, which is the labia majora, and majora means major. Okay? And then we have the labia minora that are just inside the labia majora. So these are the ones that can actually grow to be very long, and some women say they actually want it reduced, what we call labioplasty. So type 1 is cutting the clitoris and the plus or minus cutting the prepuce. Type 2 is you also include the labia minora together with cutting the clitoris. Okay. Then type 3, now here is where it gets a bit tricky. For some, they can cut also the labia majora and then they stitch it, what we call infibulation. Yes, it is quite sensitive, but the entire point of type 3 is to reduce the vaginal canal. Okay. So if you find the external genitalia has been cut and then stitched together, leaving a very small hole, that is what we call infibulation. So that is type 3. We also have type 4, which is anything you do to the female genitalia, from ear pierce, it's not the ears, from clitoris piercing, any small nick or trauma to the aesthetic trauma to the genitalia, even iatrogenic. Iatrogenic is induced or caused by either yourself or someone else. Okay? Yes, that is type 4. It is neither here nor there. All right? But what I want to concentrate on is step 1, 2, 3, and the severity increases as you go higher. Yes.
I want to smile and not to smile really.
Sorry.
Because I'm imagining, why do we pierce for beauty?
For beauty, for sexual stimulation of yourself or your partner.
Okay.
Yes. So,
wow.
To each their own.
Again, you say not judging, everybody has
their own. Yeah.
All right.